Hi, I'm Dr. Lindsay Smith. I'm a nursing academic from the University of Tasmania in Australia, and I've been educating nursing in community and family nursing for a number of years now, and of late I've been trying to take some of the evidence that we have about family nursing and about family strengths and how to embed that into our everyday clinical practice. Here's a problem for us to think about. Healthcare systems and nursing has focused so much on the technical elements and has become so skilled, is in danger of losing the capacity to relate well with families and relate well with people. And that is a real challenge to us, to be able to be technically excellent as we are, but also very capable of relating to one another and to our patients. And so that's what the basis of this talk's about. I'm going to talk about the development of the Australian Family Strengths Nursing Assessment Guide, and the premise of that guide is to help Australian family nurses to be able to relate well with families on the basis of the family strengths that those families display with one another. Family-centred care is the sort of care that we often talk about in nursing, and the problem with family-centred care is it often has the power residing in the health professional and in the family nurse. We often ask the parents to do some of our nursing care for their child or for their family member in healthcare, but we don't often negotiate, or we don't often ask them. We say, this is what you can do, and therefore we are sharing care. In other words, you're doing my care for me. And that's not family-centred care. That is abdicating the responsibility of the nurse onto the family. Of course, the family might want to do that task, but it's a different method of going about negotiating, getting them to be engaged in nursing care when we're trying to do family-focused nursing and we're trying to do a relationship style rather than a technical style of nursing. One of the things I think nursing should never do, it should never get in the way of how families function well. We certainly do have challenges when we have families coming into healthcare and coming into circumstances where they are under stress. But our healthcare system shouldn't be one, and our nursing procedures shouldn't be, that gets in the way of families functioning together. It's when families function the way that they function best, that's how they're going to maximise their health outcomes. And so therefore, if we get in the way of them functioning the way they like to function, then we're going to reduce the outcome eventually. So the idea of this sort of work that I've been trying to develop is to get the concept going that we together can have family strengths functioning within the ecology of our healthcare, within the heart of our nursing. So the heart of our nursing, as Janice Bell says, is relationship. And so through inviting families to implement their family strengths within nursing care in a shared environment, then we are relating in a way that values those families and values what they do best, which is love and care for one another. So family strengths then. There's a lot of research about what family strengths are, and the Australian Family Strengths Nursing Assessment Guide is based on the Australian Family Strengths research. And the Australian Family Strengths research identified the attributes that Australian families have said through a fairly large research project. It was published by Geggy and colleagues in 2000 from the University of Newcastle. What families said is that they have these attributes that they like to display to one another. And that's fairly common across the world. All families have strengths that they like to display for one another, and there is some research that talks about the international family strengths and how common families really are and how common around the world families function. And so we're actually more common and more similar than we are different. But at the same time, we've got to remember that every family is unique. Every family implements their family strengths in a way that no other family ever has or ever will, because of the dynamics of the people within that family. So every family is unique. So as nurses, we don't know how a family would like to incorporate their family strengths into the healthcare environment unless we ask them. We can take some assumptions and say, yes, you as a family should function this way because other families have in the past, but that might not be right. It might not be a good match for that family. So the Australian Family Strengths Nursing Assessment Guide is a resource of questions to help nurses engage with families. You can engage with the individual or with the group and ask them what are the strengths that they like to display. At the end of the conversation, you then can say, well, how would you like to incorporate these strengths into this time of healthcare, into this circumstance that we find ourselves in? And that way it's saying to the family, we value you, we value what you do for one another, and we know that when you support one another, the outcomes are going to be better, and the outcome will be better for everyone. So we want to have means of understanding how the family functions best. So the Australian Family Strengths Nursing Assessment Guide is basically trying to identify what it is that's unique about every family that we're engaging with and how that uniqueness can become part of nursing. I won't go through the guide a lot because you can read about it. It is published work, and that publication you'll be able to pick up quite easily, and that you'll have the full copy of the Family Strengths Nursing Assessment Guide available for you. So I just wanted to introduce a little bit of it to you and help you to understand what it's trying to achieve. It's not trying to assess a family and say you've got X number of strengths, you've got X number of deficits, therefore you need to embed these strengths into your family functioning. It's not that at all. What it's trying to do is trying to say, how do you as a family get together to support one another, and how can we continue doing that in this time of healthcare? So thank you very much.